Hey there, so my team at Corspite has built a small proof of concept just to show you how a caregiver can benefit from this elderly care management platform. So here I'm going to log in as a caregiver to access my dashboard, and in the main dashboard screen, I can see the list of all tasks, whether they are pending or completed, and I can also like filter them by different categories like medication, meal therapy, personal care, recreation, etc. And also like by statuses like pending and complete. And if any of the task system, I can just mark them as complete here. On the right side, I have all the list of residents that need any extra attention. For example, right now, Eleanor has low BP, Isabel has high temperature, and Samuel, missed a meal. So all of the alerts will be available in the main dashboard screen. Next, on the left sidebar, I can select the residents tab, and it's basically going to show me all the wards along with all the patients, their room numbers. So I can view all of them, or I can filter them by ward here. I can also filter them by their status. If I click here on any patient, then I'm going to see all the details about them, like their recent vitals, temperature, sugar level, blood pressure, and all the data that is currently synced from the sensor, like heart rate, etc. Next, I also have this medication tab where I can see the list of all medications that has been given to them today, and I can also skip a dose or mark them as given if they are pending. And this button can be used to add new medications. Next, we have this notes sub tab for for a resident basically. So it just shows all the different type of notes that we have added, or a doctor or a family member has added. So, and they also have all the different categories. For example, you can view all the observation type of notes, all the incident type of notes, like this has had a minor fall in the hallway near room, and no injuries were reported. So, and also as a family member, so you can also see all the notes, from a family member perspective. So this is the notes screen, and if you click on the contacts tab, then you can communicate with their family members or doctors, whoever you want to contact them. So we have these small chips here, like family or doctor, so who you can contact to for this resident. So this is the resident screen. Next, I can go to schedule screen where I can view all the schedule for today. Like as a resident, there's a physical therapy that's going to happen at 10 a.m. There's a group lunch, bingo night, etc. And tomorrow there's a visit by Dr. Reed. So all of your schedule can be viewed from here, from this screen. Next, we have messages here. So if these could be by family members, by admins, or by doctors. So you can view all of them here. So yeah, so this was a very basic proof of concept for this platform. And as far as the tech stack is concerned, I think we can use Next.js for for the web platform development, and React Native can be used for mobile apps. Similarly, we have very good experience working with AWS Cloud, so we can use their services like AWS SCS service for emails, SNS for push notifications, and also like EC2 instances for deploying the backend server. Similarly, relational database service, which we can use PostgreSQL, so that would be very good, tech stack. I think we can make sure that it's GDPR compliant and we follow all the compliance, related perspectives. So yeah, so I think this was what we prepared for and I would love to have a meeting with you, to go through these screens again and review, what we can add more here. So I think that would be a very good starting point. Thank you so much for viewing this proof of concept.